Hello and welcome. Today we're diving deep into a complex and often serious condition called pulmonary vasculitis. Specifically, we'll be focusing on one of the most well-known types, granulomatosis with polyangiitis, or GPA, formerly known as Wegener's granulomatosis. This is a rare but potentially life-threatening disease that affects the blood vessels in your lungs and other organs. Understanding this condition is crucial for early diagnosis and effective management. So, what causes this disease? The exact cause of granulomatosis with polyangiitis remains a mystery to medical science. It's classified as an autoimmune disease, meaning that the body's immune system mistakenly attacks its own tissues. While we don't know the precise trigger, it's thought that a combination of genetic predisposition and environmental factors may play a role. Certain infections, or exposure to specific substances, might possibly trigger the autoimmune response in susceptible individuals, but more research is needed to confirm this. Let's delve into what happens inside the body. In GPA, the immune system attacks small and medium-sized blood vessels. This inflammation, or vasculitis, causes the vessel walls to thicken and narrow, restricting blood flow. This can lead to tissue damage in the affected organs, particularly the lungs, kidneys, and upper respiratory tract. A hallmark of GPA is the formation of granulomas, which are clumps of immune cells that further contribute to inflammation and tissue destruction. These granulomas, along with the vasculitis, cause the characteristic symptoms of the disease. Pulmonary vasculitis, including granulomatosis with polyangiitis, is a relatively rare disease. It affects people of all ages, but it's most commonly diagnosed in middle-aged adults, typically between 40 and 65 years old. Men and women are affected equally. While it can occur in people of all ethnicities, it seems to be more prevalent in Caucasians compared to other populations. Due to its rarity and variable presentation, accurate epidemiological data can be challenging to gather. The symptoms of GPA can be quite diverse and can vary from person to person. Often, the initial symptoms involve the upper respiratory tract, such as persistent runny nose that doesn't respond to typical treatments, sinus infections, nosebleeds, and even nasal cartilage destruction leading to saddle nose deformity. Lung involvement can cause shortness of breath, cough, and chest pain. Kidney involvement can lead to blood in the urine and kidney failure. Other symptoms may include skin rashes, joint pain, eye inflammation, and nerve damage, depending on which blood vessels are affected. Diagnosing GPA requires a combination of clinical evaluation, blood tests, and imaging studies. Blood tests can detect elevated levels of certain antibodies called ANCA, or anti-neutrophil cytoplasmic antibodies, which are often present in GPA. However, ANCA tests are not always positive, and a negative test does not rule out the diagnosis. Imaging studies, such as chest X-rays and CT scans, can reveal lung abnormalities. A biopsy of affected tissue, typically from the nose, sinuses, lungs, or kidneys, is often necessary to confirm the diagnosis by demonstrating vasculitis and granuloma formation. Pulmonary vasculitis encompasses a spectrum of conditions. Granulomatosis with polyangiitis, which we're focusing on, is one of the most common. Other types include microscopic polyangiitis, eosinophilic granulomatosis with polyangiitis, also known as Churg-Strauss syndrome, and various other forms of small vessel vasculitis. The specific type of vasculitis is determined by the size and location of the affected blood vessels and the presence or absence of certain antibodies. The treatment for GPA typically involves a combination of medications aimed at suppressing the immune system and reducing inflammation. Corticosteroids, such as prednisone, are often used to quickly control the inflammation. Immunosuppressant drugs, such as cyclophosphamide or rituximab, are used to maintain remission and prevent relapses. More recently, targeted therapies that specifically inhibit certain aspects of the immune system are being explored. Treatment is often long-term, and close monitoring is necessary to manage potential side effects of the medications. Unfortunately, there's no known way to definitively prevent GPA. Since the exact cause remains unknown, preventative measures are limited. Avoiding known triggers, if identified in an individual, may be helpful. Early diagnosis and prompt treatment are crucial to minimize organ damage and improve long-term outcomes. Staying informed about the disease and seeking medical attention for any concerning symptoms is the best approach. The prognosis for GPA has significantly improved with advances in treatment. With early diagnosis and appropriate therapy, many people with GPA can achieve remission and lead relatively normal lives. However, relapses are common, and long-term monitoring is essential. Potential complications include kidney failure, lung damage, and side effects from the medications. Ongoing research is focused on developing more targeted and less toxic therapies to improve long-term outcomes and reduce the risk of relapse. Recent studies are exploring the role of specific immune cells and molecules in the pathogenesis of GPA, which could lead to novel therapeutic targets in the future.